But it does say comprehensive, affordable, high quality, and the benefits package was not specifically decided upon in the law because that's up to Green Mountain Care. There are minimums in the law, like nobody's benefits can be any less than what people on Medicaid now get, and that's a very generous benefits package. Like mental health coverage is automatic and no co-pays for anybody. That substance abuse coverage is automatic with no co-pays. That chronic care is automatic with no co-pays. So we know that certain things...
Why are mental health and substance abuse benefits no co-pays and so important to you?
Oh, okay. The reason that they're so important to me is that they impact such a large segment of our population. And they under the current system, people cannot afford, even if they have insurance, to get treatment in those areas. Because, I mean, I have a good friend who struggles with this. One of her sons has a mental health issue. And she's very well insured, but they won't pay for more than a few days in the hospital at any given time. A lot of people we know are incarcerated. In Vermont, it's more than 50% because of mental health or substance abuse issues. So I think those are very important issues. And in the survey that was filled out, the people of Vermont said those issues were very important to them. Because obviously they have friends, neighbors, or family who have had to deal with those issues. So that's why that was important.
The criminal justice relief is kind of up there on it.
Pardon me?
The criminal justice relief, it's cheaper to treat than to incarcerate?
Absolutely, because it's going to cost $300 a day to put somebody in jail, and it's certainly not going to cost that to treat them for the mental health or the substance abuse. So when we started this campaign, we were told consistently by both governors that it was not politically possible to get this law passed. It just wasn't going to happen. And this is a rally. That's our state house. You can see all the people there. And we have a march to the state house. And so the human rights framework allowed us to make something possible that they said wasn't possible. And it's a great framework because it emphasizes humanity. And we can pick that up and move it to some other area whenever we need to, whether it's food or pollution. You know, we have a right to clean water and air. And the more people that wind up getting allured and believing in the human rights framework for this movement, for example, right now, we also have a movement called Put People First, which is a participatory budgeting initiative. And everybody who believed in healthcare as a human right is really excited about this because it has to do with putting people's needs first in the state budget. We also have even more people coming together, but it's also based on the same human rights principles because it just gets rid of all the arguments that have technical points here and there or numbers here and there that A, a lot of people feel they can't grasp because they don't know enough, or that B, anytime I use a number, somebody can always come up with something from the internet that says that's the wrong number. And I get totally diverted if I do that from the main idea that healthcare is a human right and that if you're human, you're united in suffering. And that's why we use stories a lot. Because I can take the richest person in Vermont and ask them to sit with the poorest person in Vermont and tell each other a horror story about healthcare, either of themselves or a friend or a family, because we know everybody has one. I've never met anybody who says, no, I don't know anybody that has a healthcare problem. And even though the great disparity of economics exists between those two folks, when they're looking each other in the face and looking each other in the eyes as just two human beings united in suffering, that is a total leveling effect. All of a sudden, there is that bond of humanness there. And so that allows them to be united across these differences that otherwise would never allow them to come together. And since movements are built on relationships, that's the first step, is looking at somebody in the face and sharing information or saying hello, to building a movement where the people can remind the government that they work for us, not the other way around. And it also overcomes the counter and divide tactics that we all know they use all the time. And this point is what I was just saying. It's not about having the best argument. It's about having the people agree on what the points are and stand together on that. Yes?
How is this funded? Do everybody have to pay something like we do something?
The funding in the statute, Act 48, has to be public and it has to be equitable. So yes, everybody will have to pay something. What the statute says is that the Green Mountain Care Board, by the end of this session, has to decide on the financing mechanism. Now, we already know that there are a lot of things sort of going into the pot. All the Medicare, Medicaid, and CHIP money and other federal programs, not yet the VA, we don't have a waiver for that yet, is sort of going into the pot. So all of that money is there. And then the other thing is that they have to decide how the rest of the money is getting gathered. Now, Dr. Schau from Harvard actually recommended a system similar to Germany's, which is an employment tax. So that, you know, you get like 3 things taken out of your wages when you were working. But the Healthcare is a Human Right campaign says, no, that doesn't agree with what the Act says, because that doesn't have everybody paying according to their ability, and it also doesn't accomplish healthcare decoupled from employment. Because in Vermont, like I'm sure any other state, there are folks who are living off of investment income. They're not earning wages. And so under that scenario, they would get all the benefits of the health system, but they wouldn't be paying anything in. So the Green Mountain Care Board decided to have listening sessions where they listened to the people about their ideas on what they want funding. And the Healthcare is a Human Right campaign has encouraged and proposed a broad-based income tax on individuals and businesses. And also what some people are calling a wealth tax, which would really be more like an income tax on investment income, not just the interest income, which is a very smaller amount than regular income tax. And that would be fair, because people that could pay more might pay more, and people that couldn't pay anything wouldn't pay anything. So that fits the equity and the public funding. And when they first decided to have these sessions, they were having them all up in Montpelier, which, as I said, nobody can get to because there's no public transportation there. And they were having them every day. People come, tell us, everybody come and tell us. And the Healthcare is a Human Right campaign said, you know, participation doesn't mean pay it lip service. It means make people able to participate. You're having these every day up in Montpelier, but the vast majority of Vermonters can't get there. They said, oh, that's true. We aren't complying with that provision. So then they established them all around the state, and they're still going on weekly. They started in November, and I just talked to somebody on the phone before I came in here saying that they're going really well, and the overwhelming public sentiment is to do it based on an income tax, which everybody goes, oh no, not more taxes.